World Doc, Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And I'm really excited about our topic today. Doc, it's called at-home STI testing. What is the name of the recently approved at-home social disease infection STI test?
It's called VISBI, and it's pretty much hyped on the web, but there are others, and they've been around for a longer time.
Is it Food and Drug Administration approved?
It is FDA approved, and it has been approved for STI testing at home, and patients can purchase that without a prescription.
Where can people buy the test?
Your pharmacy, certainly online pharmacies like GoodRx, and of course you can go to the VIS B company site.
Do people need to have symptoms of an STI to do the test?
No, some people don't have any symptoms at all. So if for some reason or other you think you might have, then go ahead and test.
If my test turns positive, should I tell my significant other?
That would be the most reasonable thing to do, even if it's just for no other reason than to make sure you don't get your STI back again.
Does this kit test more than one kind of STI?
Yes, it does. This particular VISBI test checks for chlamydia, gonorrhea, and trichomonas.
Of these three STIs, which is the
Most common is trichomonas, according to the CDC, if we can believe that. But it's also the most common STI worldwide.
How common are chlamydia and gonorrhea in the United States?
I think these are reportable conditions, and they figure about 2.2 million of the two have been recorded in 2023.
How does the VISBI test work?
It's a single-use at-home test collection. You have to collect some urine, and you have to put the urine into a little tube, and then you have to pipette out of the tube and into the VISBI machine, and then the app will give you an answer.
If you test positive for one of the three STIs, what should you do?
You should definitely see your doctor because you need to talk about some kind of treatment. You want to avoid the complications of STIs like infertility, pelvic infections, hysterectomy, sepsis, and even death if things get far enough.
Can men get, yeah, go ahead.
Yeah, okay, good. Yes, men can get STIs, and they can get epididymitis, which is an infection of the tube between the testicles and the prostate, get prostatitis, orchitis, which is infection of the testicles, chronic pain and difficulty or painful voiding, and like I said, infertility.
What are the primary risks of the VISBI test?
You have to, any tests at all that you use, you have to worry about tests being false positive or false negative. So the FDA warns us that with a false positive test, that means a test that says you have the disease when you don't have it. You run the risk of unnecessary treatment or delay in receiving the correct treatment while you wait for the correct diagnosis. False negatives might delay your treatment for the condition you have and allow you to spread the infection to other people.
Are there any other STIs that we should be looking for?
My bias, Neil, is that we should be concerned about B strep, which we're not supposed to check for till about 34, 35 weeks of pregnancy. There's mycoplasma and ureaplasma. Those are not always thought of as STIs, but I think they not only are, but I think they're really a lot more common than some of the other things because I think you have to be concerned about miscarriages, preterm birth, infertility in men and women, and of course, stillbirths. So in my experience, I think it'd be a shame to stop looking for the other STIs.
How much do at-home STIs tests cost?
It depends on what the test is, and it depends on how many tests you're testing. Some of them will go up to a total of 10 tests, but they vary. If you go to GoodRx and look at what's available, anywhere between $99 and $300, and most of these are single tests. So you'd probably be better off going to see your doctor.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Your Way, available on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast.